Hello and good morning to my new channel where you and I discuss health. It's a privilege for me to always come on this channel so that you and I can discuss health. My name is Dr. Manu, a medical doctor specialized in ophthalmology with a passion to see you well spiritually, mentally, psychologically, and of course, physically. In this video today, you and I will discuss the pathophysiology of type 2 diabetes. Always remember that all you and I discuss in this video are only intended to be informative only. This is not a medical consultation. For all medical advice, please do consult your medical practitioner. Having said that, join me after the break where you and I will see and discuss the pathophysiology of type 2 diabetes. Thank you. Welcome back and thank you for staying tuned with me on this channel. As promised, today you and I will discuss the pathophysiology of type 2 diabetes. Unlike type 1 diabetes, the pathophysiology of type 2 diabetes is a condition symbolized by a relative deficiency of insulin and not an absolute deficiency. Very important to understand that in type 2 diabetes, the deficiency of the insulin is only relative, not absolute. This is characterized that the body is unable to produce adequate insulin to meet the needs. There is beta cells deficiency coupled with peripheral insulin resistance. Now, understand that obesity and physical inactivity are the main causes of insulin resistance and have precipitated the present epidemic of type 2 diabetes. This perspective is supported by Sin, who pointed that most individuals suffering from type 2 diabetes are obese with central visceral adiposity, and that the adipose tissue should play a crucial role in the pathogenesis of type 2 diabetes. Further support of importance of weight control is provided by Stockley and Keeler, who jointly argue that to avoid the development of type 2 diabetes from pre-diabetic state, the first step should be to reduce body weight and to increase physical activity. In 3 published randomized controlled trials, Keeler points that in high-risk individuals, lifestyle changes with modest weight loss associated with diminished fat intake and increase in fruit and vegetable consumption result in marked inhibition of the transition from pre-diabetic state to manifest type 2 diabetes. Despite what has been noted, it is important to understand that not all obese individuals have the metabolic syndrome, and the syndrome may occur in normal weight individuals. That is why it is important to understand the disease process. For many years now, many professionals in the health industry have described 3 core defects in type 2 diabetes. 1. Failure of the pancreas is beta cell to produce adequate insulin to maintain blood glucose control, and insulin resistance to both the muscle and the liver cells. This understanding of the disease led to the widespread use of insulin secretagogues as a primary medical treatment. People with type 2 diabetes took medication to increase the secretion of insulin from the pancreas. Still used today, these drugs are seeing good results in lowering blood glucose and A1C levels. However, they do not treat the underlying causes of the disease, and this is my main issue with the drugs. They don't treat the underlying causes of the disease. They just concentrate in lowering the blood glucose and the A1C levels. But they don't go to see the causes, which are in type 2 diabetes, the insulin resistance, obesity, lack of physical activities, the style of life that many people adopt daily. Those are the main causes of diabetes that the drugs that are used today don't do anything on. And you and I must understand that and try our best and work hard to be able to prevent them or eliminate them. The Defonso in 2009 introduced homogeneous octet, a total weight players key to the development and progression of type 2 diabetes. This grouping has generated greater understanding of the pathophysiology of type 2 diabetes and led to the development of many medications that target these defects. I trust that in this video, you and I have come to understand the pathophysiology of diabetes type 2. How we get type 2 diabetes. Because this type 2 diabetes is very important killer of today's modern age. And you and I must understand how we can avoid it. For if you and I don't avoid diabetes, we will become part of the statistics. How many people are dying daily? Even when you don't die, your length of life is being reduced. As we saw earlier in another video, that when a man has type 2 diabetes, your length of life is reduced by up to 5.8 years and a lady 6.8 years. Why will you die before your time? It is very important knowing how we get diabetes to try with all your might not to be exposed to those things that will make you and I develop type 2 diabetes. I trust that this video has been an eye-opener to you and I, and that from now on we will pay more attention to our body. We will pay more attention to what we put on our plate. This is Dr. Manu reminding you that your health will change when you begin to change what is on your plate. Peace. I love you. See you in the next video.